My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better decisions you can make. And today I am delighted to present Diane Gerard, and she is located in the St. Paul, Minnesota area. Welcome, Diane. I'm so delighted you can come with us.
Thank you for asking me, Tina.
Yes, and today our topic is going to be on restoration therapeutic, but that is your specialty.
Yes, Tina.
But before we get started, I want you to tell our viewers a little bit more about yourself, your passion, your love, and why this profession.
Okay, Tina, well, I am a nationally certified massage therapist, and Restoration Therapeutic actually is the name of my business. It's Restoration Therapeutic LLC.
Okay.
And I do a lot of different types of body work, and I specialize in pain management therapies. And out of that came the hand care class. Really, this was based in my own history and my own struggles with hand pain. It's very common for massage therapists to have that, and I was no exception. I thought to myself, what can I do to help myself? And I started to research the question, and I looked into a lot of different resource materials, and in the end I came up with a self-care routine that I used for myself, and within just 2 weeks it was quite amazing. My pain was almost completely gone, and within a month it was gone, and now I can work as many hours as I like, really, without experiencing pain in my hands. It's been quite a phenomenal change for me. And so now what I'm doing through the hand care classes, I'm teaching those same techniques to other people.
Wow, and what a great concept to do it more natural than actually having to take pills all the time for any type of pain that you have. And you know, this day and age with all of us working on computers and typing, you know, and we use our hands so much that it's amazing that I'm surprised that we haven't had more, you know, pain and all the carpal tunnel that we're enduring and the surgeries and all of this. And to take this as our first step, you know, instead of going into the doctor and knowing that, oh yes, you have carpal tunnel, we're going to have to cut you.
Yes.
And to try this.
These techniques really are ideal as a preventive measure because carpal tunnel syndrome, it's usually something that is developed over a very long period of time, and people are experiencing pain a long time before they ever get a diagnosis. And so if people could really learn what to do to help themselves when they first start to experience even the first signs of discomfort, I think a lot of these surgeries could be avoided. That's just my opinion as a therapist from what I see in my practice. But the muscles, they want to relax. They, you know, they don't want to be all tense, and there's very, very simple ways of helping to create that for them. And in the class we use different movement techniques based on a principle called neuromuscular reeducation. And I also teach people how to use massage for themselves, and it's very, very effective, Tina.
Yeah, well, it's such a great idea to, you know, go and take one class with you, and then you can actually have a lifetime of helping yourself.
That's exactly right. I always tell people that this is really a very cost-effective approach because you pay once to take the class and you use the techniques forever. In fact, most of my clients have taken the class, and especially all the clients with hand issues. I used to do a lot of work on their hands and forearms, and almost never now because they do the work for themselves.
So how did you come up with this great idea? I mean, you were your own subject in that sense, but how did you come up with this great concept of, you know, go ahead and basically
bringing it to the world? Well, Tina, when I started doing these techniques and having such great success, my sister sent a couple friends to me that wanted to learn what I was doing. They were both experiencing a lot of trouble with their hands, and so she asked if I could teach them what I was doing. And the idea for the class was born at that point because clearly there's a lot more people out there than two people that have pain in their hands and in their forearms. So I started to develop the course and started to bring it to the general public.
Yeah, I'm sure that our viewers, there's probably 98% out there that are, you know.
Yes, it's so common. It is so common. And most people are having pain of some degree. Maybe it hasn't advanced to a diagnosis, but my hairdresser took one of my classes, and she told me that she'd had pain in her thumb for 20 years. That went away. after using the techniques in the class. And so, you know, this wasn't a disabling thing, it was just a discomfort that she had lived with for a long, long time. But it went away for her. She was very excited, and of course it's very exciting for me to hear these stories that
well,
people come back with.
Yes, because we're all thinking that we have to live with this pain.
Right,
You know,
or there's
oh,
nothing
yeah.
to do.
Because you go to your doctor and, you know, you talk about something that's happening and it's just your finger.
Right.
But yet, you know,
Right.
every day when you get a thorn or something in your finger, it really hurts.
It
a
hurts
lot.
you.
Yeah.
Yeah, it hurts you. And also muscle tension is not something that shows up on most diagnostic equipment. So you have to be pretty advanced in the problem before it's going to start to show up sometimes. So this is a great self-help measure for the early stages of problems where it is still in the muscle tissue and in the soft tissues.
Yeah. And this technique's not just for females. Of course, we can get the men and children and everyone on board with this.
You know, I will say that the classes, there's a lot of women in the classes, but women tend to take care of themselves a little bit better. But I did have several men come, people that maybe barbers I've had, and construction workers too, besides just people that work on the computers. I had a guy that did construction, and his comment to me after the class was, Diane, there are so many guys in this town just like me that are really struggling with issues in their hands. And so, you know, definitely it's for everyone.
Right. Even the macho men.
Even the macho men, that's right.
Yeah, what? Go get my hands fixed? No, I'll just, you know.
Well, you know what? We all struggle with pain, and if, you know, our hands are so valuable to us, it really makes sense to protect them and preserve them and do everything we can to keep them functioning at their best level. In fact, the techniques in the class, it's not just for relieving pain, but it can help you to improve your function. It would be a great thing for musicians or people like that that really rely on the flexibility and the dexterity of their hands to increase that ability.
Sure. Not just those of us typing away on the computers all day long. That definitely
Well,
help them.
that helps us too,
Yeah,
yes,
but not
it certainly
just them,
does.
yeah.
But it really
Anybody.
extends to any occupation that uses the hands.
That's life.
It's
Anyone.
life.
That's
It's life.
any
yes.
human. Every one of us use our hands. So
For something.
yes, exactly. But of course, for someone to take the next step, they have to be in pain.
That is most often the case. You know, I have had some people come to the classes that come just really for prevention.
No,
but
that's a smart
I've had a
move.
lot more people come because they're in pain.
Yeah.
Pain speaks to us, and it tends to get your attention. You tend to want to do something about it.
Right. And I know that there's a little technique that you're going to show us. That you were talking about some flexibility that we can.
Sure, Tina.
Yeah.
Yes. The movement techniques in the class are based on a principle called neuromuscular reeducation, which means that we're going to use the brain to send signals to the body to relax. And how you can do that in a very easy way. Oh, and this technique should not cause any pain. The people at home can try it if they like, of course, at your own discretion. But it shouldn't cause any pain or any symptoms. If you do experience any pain or symptoms, you want to stop. But what you would do is you put your hands together. I call it moving prayer hands.
Okay.
And you just very gently move your hand through the range of motion. And you never want to bring the hand past 90 degrees because that puts strain on your wrist. So you're going to stop right at 90 degrees or whatever is comfortable for you. It's not stretching.
You might want to slowly do it.
Slowly. Slowly and very mindfully, you want to pay attention to what you're doing here. And you should start to feel all of the muscles really loosening up. Then you can reverse the direction and go away and towards you. And this just helps to release the muscles that control those motions. And by doing the alternate contraction and relaxation, it really helps to loosen up the muscles along all sides of the forearms, the wrists, and into the fingers as well.
Okay.
And can you feel any difference in your hands, Tina, just from doing that little bit of work?
Yeah.
Isn't that something that it's so simple? And I think that in our day-to-day work, especially at the computer, you get so programmed that your mind just forgets that it can use these different motions. So really, we're just bringing back the element of choice.
Okay.
And a lot of times when you bring back all of the choices the body has, it's going to relax into the more natural, neutral position.